Looking at where we go next and where you can go back in your practices, we have a prescribing review tool which allows us to see how many patients are getting the same acute in a 12-month period, for example. So you can put in 4 acutes in that 12-month period, 6 acutes in that 12-month period, and that will give you a list of patients who are reordering that same acute. And there's different ways of doing that. We've heard some of the ways, but we can also identify a GP champion, and that's the first example, or agree a shared care approach, which is the second example that I'll come on to, or actually a bit of both. And whatever works for the practice, there will be trial and error. Something will work well, it may not work so well in other practices, or some partners may not feel that that's the best for them, but it's about engaging and supporting. Next slide. So in the first example, identifying a GP who's willing to champion a change, having a look at the report that you've just drawn up, and then thinking about what can move straight to repeat without clinical review. So things like emollients, catheters, etc., that may be coming through an acute, just bung them on to repeat. Things that are more worrying, so things in the amber category, maybe it's things around pain relief, does it fit in with our chronic disease management? Again, looking at what's coming up in those categories and taking a kind of practice-wide decision to support the technicians with working within the practice and the pharmacists to consider how they can either put them on permissible repeat or on to repeat. And then there's the red category, so things that you are concerned about or which should only happen once, for example, antibiotics or some of the stronger opiates that you may fear that the patient is overusing. Having the practice meeting and then working through that. Next slide. Or you can think about it as a sample shared care agreement. So again, coming up with a list of drugs that you would be happy to go into acute or to repeat rather, or permissible repeat, and set the criteria for that, which allows the technicians and the pharmacy team, and particularly the technicians, because they're a fantastic resource in practice, to be able to put these things onto repeat or permissible repeat safely, and everyone's happy with that. And you can home this into your own practice preferences, etc. Next slide.